Greetings to all. I warmly welcome you all at the platform of University of Lahore, Faculty of Allied Health Sciences and Epitome of Excellence. I am Ruhama Yousaf, faculty member at the Department of Health Professional Technologies. Sharing will enrich everyone with more knowledge. I have been bestowed upon with the opportunity to share my experience at the University of Lahore. I was appointed to serve as a senior lecturer at the Department of Health Professional Technologies in September 2020. My qualification comprises of BSc Honours in Respiratory Therapy from University of Health Sciences and Master of Philosophy in Public Health from the University of Lahore. Teaching is a passionate profession, and I commenced it with great vigor and passion that still prevails. In fact, it has been boosted by being a part of this esteemed organization. Diverse undergraduate programs of allied health sciences comprising of 4 years fractionated into 8 semesters are being offered here. One of those constructive programs is BS Respiratory Therapy, and I teach brilliant-minded undergraduate students of respiratory therapy. I have been teaching the subjects of cardiopulmonary diseases, respiratory therapy and infection control, pediatric and perinatal pathophysiology and critical care, mechanical ventilation clinical, pathophysiology of altered health state, pulmonary rehabilitation, and advances in respiratory care. In the course of cardiopulmonary diseases, students are taught about the history, manifestation, pathogenesis, detection, diagnosis, treatment, and prognosis of cardiopulmonary diseases. They learn about the etiologies of diseases that affect the cardiorespiratory system and acquire the understanding of pathophysiological changes associated with different cardiopulmonary diseases. Respiratory therapy and infection control is a subject in which the students learn about the infection control practices for infectious respiratory illnesses, the standard precaution for respiratory illness and care of patients, including procedures like hand washing, gloving, and the use of personal protective equipment. Clinical skills practice opportunity is provided during the course for practice of clinical skills in a stimulated environment. Individual skills relevant to the care of a patient with an infectious respiratory illness are demonstrated in order for the students to gain competence in the necessary skills. In pediatric and perinatal pathophysiology and critical care course, theoretical application of the respiratory care to pediatric and newborn patient is focused. Pediatric care techniques utilized by the therapist are reviewed. This course provides students with a review of in-depth pathophysiology, evidence-based care, and skills to care for critically ill children. Mechanical ventilation and mechanical ventilation clinical are courses in which students are given general information and taught about mechanical ventilation with emphasis on ventilator classification, methods, principles, and operational characteristics. It includes indications, complications, and physiologic effects or principles of mechanical ventilation. It emphasizes initiation, management, and weaning from ventilatory support, along with hands-on training at the University of Lahore, teaching hospital under the supervision of highly qualified and skilled respiratory therapists. Pathophysiology of altered health state is a course designed to provide the students with knowledge about disease and dysfunction from anatomical and physiological perspective, with emphasis on integrating knowledge of tissues and organ systems into a holistic framework of body function and dysfunction. It provides the students with a strong theoretical perspective on the mechanisms of normal and altered functioning of human cells, organs, and organ systems. Pulmonary rehabilitation is a course that provides general information based upon a thorough patient assessment followed by patient-tailored therapies that include, but are not limited to, exercise training, education, and behavior changes designed to improve the physical and psychological condition of people with chronic respiratory diseases and to promote the long-term adherence to health-enhancing behaviors. One of the emerging professional directions in respiratory care is the establishment of advanced practice in respiratory care at the graduate level. This course currently relies on competency-based education as evaluation and assessment. The future respiratory therapist will be considered advanced practice providers as students will be introduced to e-medicine and respiratory care. They will be able to learn about the pulmonary function testing, bronchoscopy, extracorporeal life support, respiratory care in alternate settings, and sleep disorders. Apart from this, I have been given some additional responsibilities of being the curriculum development coordinator, research focal person, and nowadays I am serving as the research coordinator for undergraduate programs of Department of Health Professional Technologies. These responsibilities have groomed and polished my organizational skills, leadership skills, teamwork, and presentation skills. The University of Lahore is an educational organization that not only makes its students competent professionals but also keeps its faculty well equipped by conducting faculty development sessions and motivating them for research. I will conclude this video with the note, don't take a single breath for granted. Department of Health Professional Technologies under the umbrella of Faculty of Allied Health Sciences welcome all the students searching for enlightened future to get admission in the University of Lahore and become exceptional respiratory therapists and scale the highest peaks in this field. I hope this video will be helpful for you. Thank you very much for your precious time and attention.